Thank you, Howard and Purvi and Kristen. This was excellent. So basically, physicians believe patients, all of us agree that patients could be better prepared for conversations concerning treatment options. But I find this interesting that more than a third of patients wish they had asked more questions at the doctor's appointment during the visit. And while on the flip side, the cardiologists feel that patients are not as informed as they should have been about their treatment options. So there's this dichotomy, and I think we as a medical community can and should strive to come to a happy medium. Kristen, how do you help understand, your patients, what questions to ask? I mean, is there a role for a prep meeting before the actual Super Bowl when they come to see the heart team? I mean, how do you best help them? Can you help navigate that?
Yeah, that's actually a great scenario you just kind of painted in our heads. We kind of do a prep meeting before the big event, the big valve center meeting, and what that entails is a phone call from one of the APPs on the phone to kind of go over exactly what's going to happen so that they could expect, the layout of the day, the Super Bowl as you mentioned. So we tell them that this is the day you're going to meet the team, and this includes the interventional cardiologist and the surgeon. So we're going to talk about all the treatment options that are possible, whether it's surgery, whether it's TAVR, whether it's TMVR, whether it's mitral clip, whatever it is, the doctors that you're going to be meeting that day are going to tell you what you qualify for. And it could be more than one thing. It could be just one thing, but you're going to hear all your options. We actually prep them by sending home a folder that has a lot of information regarding transcatheter therapy, regarding surgery, regarding, any treatment option that would be possible, specific to whichever type of valve disease they're coming in for their evaluation for. And we tell them to read it. Patients do, they listen, they come in with it highlighted and underlined, and what does this mean and what does that mean? But that's a good thing. That means they're prepping, for their appointment, and they're preparing themselves. So I love that when they come in with a list of questions, with our little pamphlet all marked up. And I also tell them, make sure they come in with whoever their support system is, whether it's their family or we can get them on the phone. Of course, now we've adapted with COVID to a lot of virtual meetings with them while they're in the room. But this is their time for whoever their support system is to also come and ask their questions and hear about the process as well. We also include the referring physician because they know their patient the best. We're meeting them for their first time. So we've called them directly in the room. If it's not a clear-cut case, what do you think? We always follow up, of course, after to let them know what we think, but we really want to include everyone so that the patient feels comfortable in making their informed decision. So a lot of prep work, I think, which is key.
And also laying up expectations on the day of the visit that they may not, everybody's part of a team. This is, so they may not get to, just because they don't get to talk to Dr. Herman on day 2, 3, 4, 5, 7, 8, 9, 10 is okay, because there may be somebody else in the team who can answer the question. So anyway, that was excellent. So from my perspective, the top 3 teams, 3 items that cardiologists believe would better prepare the patients would certainly include having a family member or a friend attend the visit to take notes and ask follow-up questions. Of course, we know during the COVID times, this has become a bit challenging, but folks have adapted nicely. 59% seem to think that's important. 53% seem to think that use of a decision aid is important, and cannot underscore the importance. Come with a list of questions to ask during the appointment, because that I think is when everybody is zoned in and have undivided attention. So with that, I would like to introduce Adam Pick from who would represent the patients. Adam, do you agree with this data, or would you have your own perspective?
Yeah, so thanks so much, Dr. Desai. And before I go ahead and answer your very important question, I just really want to acknowledge the ACC and Medtronic for actually all the great work that you guys are doing, bringing together all of these resources to have this very important discussion. So as a patient, as I answer these questions, I want to let you know that I'm bringing in my perspective, but I'm also bringing in about 14 years of patient advocacy work that includes qualitative analysis and quantitative metrics, which you'll see to help really give a well-rounded response to, again, these survey responses. So the first one, family members being present at appointments. Let me tell you about my personal story. My mom was with me at my cardiologist. My dad was with me at my surgeon consults, and I even brought along my brother to my cardiac rehab appointments. And why is that? Because it just helps the patient process, interpret information, digest information, share information, and discuss. So full support of that. Use of a patient decision aid. This one kind of falls outside of my realm of knowledge. I don't know much about what those decision aids are, but as a technologist, anything that can algorithmically provide some results or validation for thought processes, I'm all for. But then again, technology, who's using it and how they're using it, we all know that every time you get a new iPhone or some technology, there is some learning that has to go there and some behaviors that need to adjust. Bring question list to appointment. No doubt, white coat anxiety is rampant. And it is probably heightened when you're talking about something that is as near and dear to all of our hearts. So I not only encourage patients to bring questions, I actually encourage them to record the session on their smartphone because, as we all know, you can only remember so much information. And when you're hearing health terms, it's not always easy to really understand what's being said that first time, but if you can listen to it on playback, that definitely helps. If you're wondering, my story is I was born with a bicuspid aortic valve. I was asked to talk a little bit about it to see what my heart team did well. And I had aortic stenosis and aortic regurgitation. I was real active when I heard that I needed to have heart surgery. I'm a runner, I'm a swimmer, I'm a surfer, I'm a skier. And so I wanted, just like you saw in that survey that was already addressed, an active lifestyle. And maybe naive at the time, but I'm 33 years old and I'm thinking to myself, I want a one and done, right? And that's, I think, what a lot of people think here. This is going to be a one and done, show me the perfect valve, which we know, again, doesn't always exist. And my medical team did a lot of great things. They offered options. They listened to me. They shared the risks of one procedure versus the other. And they explained, because I was so young, what the re-op scenarios could be for me as a congenital patient. Interestingly, consensus for me, and I think this was just a fantastic gift, came quickly. So I met with two surgeons. They both said, hey, the Ross procedure is something that could be of value to you. Luckily, knock on wood, I'm approaching my 16th anniversary and I am completely free from any reoperation. Again, knock on wood. So my story is one, though, that is archived, right? Because it was all the way back in 2005. That is not what patients today are experiencing. They're experiencing what I consider to be a much different setting for valvular treatment option decision-making. And the baby movers are in full effect, right? This cohort of 70+ million people are doing what they've done, whether it's Lee Iacocca's minivan or Jane Fonda's workout tapes. They are consuming and they are very, very good at it. And so as they shop, the therapies that are available to them are, I think we all agree, much more today than they were 15 years ago. SAVR, TAVR, TMVR, big R, little r, minimally invasive, robotic. You might hear Ozaki, heart annuloplasty ring, valve and valve, all these things. Then the taper of that is the recovery. So cryoanalgesia, rigid sternal fixation, all these things could be complicating the process for patients today. And you're also hearing, as people live longer, what's my lifelong plan, right? We just did a video with Dr. Wilson Zito all about this. What do I need to think of today going forward and even forward after that next potential second intervention? So at the end of the day, I'm going to echo what I've heard several times here, which is just, It's about the patient. Said different, patient centricity, I think, always helps. If you can listen to their individual needs, which are stated, you might actually hear some of the latent needs that they don't even really know how to contextualize for you. So I hope that helps with some key considerations. Going on to the next slide, what you're going to see, this is fresh. I don't know if it's called hot off the press, hot off the survey press, but just a few weeks ago, we did a survey of, it was a 4-day survey online. We surveyed 2,000 patients. And I pulled this out for the conversation today. I thought it was interesting. Is one of the questions is, what is most important for you when talking to a doctor about your heart valve treatment? And you can see, listening to my concerns, spending as much time as needed to explain my options, answering my questions. But the number one thing was, include me in the treatment selection process. I think that really speaks to what we're talking about here today, is patients want to be part of your heart team. Next slide. The challenge with that, though, and again, this has also come up, is the education. And Kristen, I love hearing about all the materials you give your patients, but for post-operative patients, when you ask them a true-false question of, my medical team provided me the educational resources I needed before surgery, there's kind of like a happy face, sad face scenario here. Happy face is 57% of patients said true. But look over on the right side, 42%, almost 43% of patients said false. There's still much more education, I believe, that needs to occur. And if it occurs, then what happened? It empowers the patient to be part of what? Your heart team. Hope that helps.